Assalamu alaikum and welcome back to another episode of What's Up Doc. I'm your host, Dr. Aalia Al-Barwani, and this is What's Up Doc on Muslim Network TV. Muslim Network TV is streaming live almost every day, and you can find us on Roku TV, Apple TV, Fire TV, and Galaxy 19 satellite. You can also find us on our website at muslimnetwork.tv, as well as our YouTube page at youtube.com/Muslim Network TV. Think that your dental health is not affecting your medical health? Well, think again. Did you know that poor dental health is linked to poor outcomes as far as heart disease, control of diabetes, as well as early labor? Joining us in that discussion today is Dr. Fariha Querishi. Dr. Fariha Querishi is a graduate of the University of Illinois at Urbana-Champaign, where she earned her bachelor's degree. She then went on to earn her doctorate degree in dental medicine from Midwestern University in Downers Grove, Illinois, where she served as president of the American Association of Women Dentists. Dr. Qureshi currently works as a general dentist in Naperville, Illinois, with a focus on cosmetic and implant dentistry. She treats all ages and is focused on providing the most advanced dental care in a comfortable and pleasant atmosphere. She's a firm believer in staying current within her field, as well as in preventative care, and emphasizes oral health education as part of her consultation with all of her patients. Dr. Qureshi enjoys spending her free time with her husband and her two daughters, and she also enjoys sharing oral health tips with her followers on Instagram at the.tooth.fairy, that's F-A-R-I, where she discusses common misconceptions and answers questions. Welcome, Dr. Qureshi.
Thanks so much for having me, Dr. Barwani.
Of course. I mean, like I mentioned in the intro, our dental health is super important when it comes to our medical health. Definitely. I mean, the two are very tightly intertwined. And I think a lot of people overlook that fact or don't even know that that is something that is a fact. And so I wanted to have that discussion today because there are a lot of misconceptions other than what I just mentioned as far as what is good oral health, am I doing enough to brush my teeth once a day and things like that. So let's start off with some basics. Let's talk about what is good oral health, or what are the basics of good oral health?
So when we're talking about oral health, I know one of the first steps is brushing your teeth every morning and night, and then also making sure you floss. One of the things I've noticed is patients tend to say, yes, I've brushed my teeth, I do a great job, but the flossing kind of is forgotten, or it's just, seen as too difficult. But most of, a lot of that tooth surface that you're missing between the teeth, that's where we see a lot of cavities. So I think that's one of the key points, is to make sure you're brushing every morning and night, followed by flossing, and then also seeing your dentist every 6 months, because there might be an issue that you're not aware of that's developing, and waiting until you actually feel something, it might be leading to more extensive treatment. And that's, I think, one of the bigger misconceptions is, nothing hurts. Do I really need to go in and see my dentist? And that's, you want to get to the problem before it starts hurting, because once that cavity gets past that outer layer, outer layer of your tooth, it actually starts to go towards the inside of your tooth, where, you have the nerve, and that's when you start feeling pain. Once it's to the point where you're feeling pain, then you're looking at more extensive treatment.
Got it. So when you are feeling pain, a lot of times you're really way past when you should have come in to get your teeth looked at. Yeah. Is that right? Yeah. So when it comes to, you mentioned flossing is super important, of course. We'll get into that and how to make things easier for patients to be able to do that regularly. But when it comes to brushing our teeth, I've heard that there's, I think, is it 2 minutes or 30? Like what is the ideal time? Is there a time that we should be, what am I trying to say? Number of minutes that we should be spending on brushing our teeth? Because I know that a lot of these electronic toothbrushes have like a buzz or a timer or whatever, and you're supposed to spend a certain amount of time in each like section of your mouth. Is that a gimmick? Is that something we should really be paying attention to? What are your thoughts on that?
Yes. So there is a certain amount of time that's recommended. It's 2 minutes. So when you buy this electric toothbrush, you'll hear it beep probably every 30 seconds. And why that is because the surfaces of your tooth, you have the cheek side of your tooth, the biting side of your tooth, and the tongue side of your tooth. So every 30 seconds is for each quadrant, which is each portion of your mouth. So I know it seems like a lot, but when you're brushing, all you want to do is you want to make sure you're going on the outside of your teeth and then towards the surface of your teeth, 10 seconds, pretty much each surface. And if you do that, say 30 seconds, 30 seconds, 30 seconds, and 30 seconds, there you have it. So, you know, you should spend about 2 minutes brushing, trying to get all the surfaces of your teeth, because if you miss one side, that, you know, that might be the side where you end up getting a cavity. And if it happens repeatedly every time you brush, then most likely that's where we'll find some plaque, some bleeding, and some cavities.
Got it. Okay, that's good to know. So for those who don't have a fancy electronic toothbrush, they can set a timer, a 30-second timer, and then just reset it for every quadrant or something like that, or just watch your clock and kind of count. There are different ways to do that without having to spend a lot of money.
2 times
Yes.
in your head. You know,
exactly.
A song that you like that's for 2 minutes, just put it on and then you can get started with brushing.
Yeah. Exactly. Perfect. As you mentioned, so you said pain is unfortunately a big motivator for patients to come in, but a lot of the dental issues and the dental problems happen way before pain is a symptom. And I just want to draw parallels when it comes to medical health as well, right? Diabetes is usually painless, high blood pressure, high cholesterol. And so, but you still come in, or you're supposed to come in yearly for your checkup, especially when you're, you know, we had recommended previously, probably in your mid to late 20s and older, you want to come in every year and get a checkup. Just similarly with seeing a dentist, you want to go in before you start to have symptoms. And how often do you recommend people come in to get their teeth looked at? And what are you actually looking at when we come in?
So we recommend every 6 months. So bacteria can build up honestly within a few days and start working on breaking down your teeth. So it's important, you know, even if you had a great checkup 6 months ago, come back in, see your dentist, you know, every 6 months. When you come in, what we do is, you know, typically we take x-rays, and x-rays are a way to see cavities that are between your teeth in areas that we're not able to see with our eye when we're checking in the mouth. So we'll bring your chair back, we'll ask you to open wide, and we'll start looking. So what we look for are, you know, any areas that the tooth is actually breaking down. We'll also not only check the teeth, but, you know, under the tongue, around the cheeks, the throat. We check your lymph nodes, your thyroid. We make sure everything in your mouth and or in the surrounding area looks nice and healthy. We typically also do oral cancer screenings, which are, you know, it's very important to get that checked as well. And from there, you know, we may also take photos. It kind of depends on what dentist you go to, but kind of as a baseline of where you started, and, you know, keeping track of anything as well. And then we also check gum health when you come in. So, you know, gum health is just as important as keeping your teeth healthy, because if your gums are not strong, your teeth will get loose and they can fall out. And that is called periodontal disease. When that bone structure that holds your tooth in place starts to kind of deteriorate or break down because of bacteria in the mouth around the gum. So that's also something we check, and we measure it out, and we make sure things are looking good in that. And that's typically the exam.
Got it. Okay. So none of that sounded painful.
Yeah. So, it's typically just taking a look. I think a lot of what I see personally is more fear
Mhm.
of, hey, this is going to hurt. So I always tell
Exactly.
my patients, if anything bothers you at all, we're just taking a look today, but just let me know. You know, the key to kind of getting through it is having confidence and knowing that we're not here to make things hard. We want to make sure you're comfortable and we want to make sure you're healthy.
Absolutely. Those are important points because just like you said, I think a lot of people, it's that fear that they're going to, not only that it's going to hurt, but that you're going to find something. I hear that a
Yeah.
lot from my patients as well. It's like, see, this is what happens when you come to the doctor is you find something. And I'm like, it was already there. I
Yeah.
just uncovered it. I didn't
Yeah.
cause your diabetes.
Exactly.
And
So
so,
that's
yeah, that
same
mentality I
thing.
think is probably there in oral care. Exactly.
Yeah.
Like you want your doctor or provider to uncover the issue before it becomes a bigger problem. And so
Right.
that's the importance of preventative. We talk about preventative care a lot here on this show, and I'm glad that you are similarly a big advocate for that.
Definitely. Definitely.
Exactly. So you mentioned a few terms that I want us to get into.
Hmm.
You mentioned plaque, cavity,
Yes.
periodontal disease. So let's start with plaque and cavities. What are they, and what's the difference between the two?
So plaque is just bacteria that's sitting down, and there's debris in our mouth. And when I say debris, sorry, I mean, we're eating food. We have stuff that we
Mhm,
miss or don't take out of our mouth. Say we didn't get to that one spot that's always hard for us to get to,
mhm.
and that's where the food sits. And there's bacteria that's in our mouth that starts to break that down
Okay.
and use it to actually build its home in our mouth. So it's interesting. Everything is trying to survive, and there's bacteria in our mouth, and they're trying to create their home around our teeth. And then we start seeing, this white material that sits on the teeth. Once that sits on the teeth for a while, it starts to harden and it becomes something called calculus. Now, that is something, if you run your tongue along your teeth and you feel like your tooth and then maybe something rough around it, that's some buildup that's on your teeth. And now that plaque has created kind of like a barrier, a wall to protect itself from your natural saliva and other ways that our body tries to prevent it from forming. So it builds this wall that's really hard to get off. And the only way to get it off is coming to see your dentist. And we have instruments and tools that actually break off that. It's like rock-like material that's just sitting
Wow.
on your teeth. And that creates your body to kind of react to it. Imagine this wall is pushing on the gums and it's pushing on the teeth, and your body has this natural inflammatory response, which just means swelling, bleeding, and it's trying to attack the bacteria. And in that process, you start to lose bone, and that's called periodontal disease. And like you mentioned, periodontal disease is linked to a lot of different health issues in the body. So it's important to get ahead of it. It does infections in the mouth, and it is an infection. Can lead to bacteria spreading throughout the rest of the body and affecting other organs and your overall health. So that's periodontal disease. That's plaque that sits on your tooth. And then the other side of it, there's bacteria, and it's also considered a bacterial infection. Are cavities. We think of cavities like, oh, I have a cavity, but it is considered a bacterial infection. There is bacteria that's sitting on the tooth that actually breaks down tooth structure by using foods that we eat as energy. So we
Wow.
eat something that we like. So
Mhm.
we love our chocolates, our
Candy.
sticky
Yeah.
sour candies. We all have our guilty pleasures. So
Mhm.
so that's we like that, but so do the bacteria. So they'll take that as energy, sugars that we eat, break that down for energy, and break it down into acid. And that acid is what breaks down our teeth. So that's that whole process of that bacteria taking the food we eat into breaking down our teeth, that happens, in a short period of time. So we want to make sure that we are, if you eat something sugary, acidic, you rinse with water. If you have something acidic, say you have orange juice, which surprisingly, it does break down your teeth. Okay, so
I mean, naturally, it's got both, right?
Yeah.
It's acidic and it's got sugar in it.
Exactly. So that's one of the big things. Lemonade. I've seen a lot of cavities just by drinking those regularly. You want to make sure if you have anything acidic that you rinse with water afterwards, and then you actually have to wait to brush. So you don't brush right away. You wait till the acid in your mouth kind of neutralizes. So rinse with water, try to get that taste off, and then wait 30 minutes and then brush your teeth. And the reason why we do that is because the enamel, or the outer layer, that strong barrier that we have that protects our teeth, is actually getting broken down by the acid. And when that breaks down and you start to brush, that wears away your enamel. That can lead to sensitivity, that can lead to even yellowing of the teeth, and that can lead to cavities. So
Wow, I just
the breakdown there.
I've never had a dentist tell me that about, with respect to like orange juice or lemonade, acidic foods, to wait to brush your teeth. And that explanation is beautiful. And, it adds up, but it's not something we think about.
Yeah, it's these daily things. And it's the fact that, we're constantly eating, we're doing all these different things, and we might, some people might have medications that cause dry mouth, just different issues that kind of increase the chances of getting cavities. And knowing little facts like that can actually reverse those cavities. So don't lose hope if you feel like, I've been doing that a lot. If there are cavities starting and you start using, say, fluoride toothpaste, or you rinse with fluoride mouthwash, those things actually help strengthen that outer layer of your tooth. And that outer layer is the hardest substance in our body. So imagine that outer layer regenerating, reforming, and cavities actually reversing. So there is hope. The flossing, the avoiding acidic, sugary foods, and then, just rinsing with some water after you have something sugary or acidic.
That's excellent advice, Dr. Qureshi. I want us to keep talking about cavities a little bit more, because I know that there are some things that we can share with our audience as to what happens when we ignore cavities.
Yes.
But before we get to that, we have to take a short break, and we'll be back to talk about that. Right. You're watching What's Up, Doc, on Muslim Network TV, and we'll be back after this short break.
My wife, who she's a professor at the University of Cincinnati, who's Catholic, and by her watching and listening to our 3-year-old son watch Adam's World, she ended up taking Kalima Shahada. She embraced Islam because she learned so much about Islam and the other prophets. It really affected our life in a great way, and because of Sound Vision and Adam's World, we're Muslims.
I took my Shahada 15 years ago, and I actually am from a rural part of Ohio. And so I found the catalog for Sound Vision, and I ordered the tapes and the CDs and the books, and I used those, and especially for my little daughter, that's how we basically learned our Islam, and Islam entered our hearts through the wonderful works of Sound Vision.
Okay, assalamu alaikum, brother. I just want you to know that I love the Sound Vision website, that a lot of times when I'm looking for information, especially as it relates to homelessness, domestic violence, and women issues, I go to that website, and then I see what you've written, and then I copy and paste it and spread the word, because the wisdom is there. So I can't do any better than what Sound Vision has already done.
Sound Vision is our survival guide. It is the organization that provides skills for Muslims how to survive and thrive in this community here in the U.S.
Assalamu alaikum, my name is Anam, I'm in 11th grade, and I grew up with Adam's World, and what it taught me was unity, respect, and love for the Muslim Ummah.
Adam's World is the greatest show ever made. Take me to the Kaaba, man. I love that puppet.
Welcome back to What's Up, Doc. I'm your host, Dr. Aalia Al-Barwani. Before the break, we were talking with Dr. Fariha Querishi about dental disease and dental oral care. As far as what we were discussing before the break, we were talking about cavities, plaque, periodontal disease. What do those things mean? How are they caused? And things like that. So we were talking about cavities, Dr. Qureshi, and you were telling us about how sweet and acidic foods are particularly the worst offenders when it comes to cavities and the effects that it can have on our enamel, and that being the hard surface on our teeth and the hardest surface in our bodies, which is pretty awesome.
Yeah.
So let's talk a little bit more about that and what happens. So when a cavity forms, so you said it's a bacterial infection essentially. So walk us through that process. What happens when a cavity does form? And then what happens when a cavity is untreated, left untreated? You know, what are the effects of that on our mouth and then potentially in our bodies as well?
So I actually have a little picture of a tooth here. So
okay, awesome.
So this is probably the best way I can describe this. So when this is a tooth, this is below the gum line here. This is the top, which is.
Could you bring that picture just a little bit more forward, Dr. Qureshi?
Sure.
Yeah, perfect. Okay.
Can you see it?
Up and close.
Okay.
Yes, close and personal.
Okay. So this outer layer, that layer is called the enamel. That's what we were talking about earlier. That's the hardest tooth structure, or in the body. So once a cavity forms, it can go through this area. If we catch it early enough, typically in this area, it's just a filling. Even here, it's just a filling. That is, might not even be hurting you. You might not be feeling it, but we'll see it on an x-ray, or we'll see it visually in the mouth when we check. Now, when we leave it and we're not feeling it and we don't come into the dentist, or, it's not really bothering you, you don't notice anything, time goes by, and the cavity starts to grow within the tooth. I'll come closer here, and it goes into the center area. This is where our nerve is. This is the thing that gives us our sensation, our feeling of pain, of cold, hot. That if you've ever had a toothache, that electric feeling that you feel, that this is what's responsible for that. So if you're waiting till that tooth starts to hurt, that cavity has gone to the center of that tooth.
Okay.
Now, once it gets there, we need to do more extensive work. So it's not going to be a simple filling. It will be something called a root canal. Now, a root canal is, and I'm going to come back closer here so you all can see. A root canal is when your doctor is going to go into the center here, clean out this nerve, and fill it pretty much with a filling for the inside of your tooth. Okay, so once that's done, a cap needs to be placed, or a crown needs to be placed over that tooth, just because that tooth structure is probably very weak and would not be able to withstand, chewing forces and things like that. So a simple filling can go to, again, more extensive work, more extensive treatment. But if you need it, that's the best option, is doing that root canal, getting a crown on that tooth. Once that procedure is done, it's just like any other tooth. You won't even know, that it had a root canal or not. It's in your mouth. It's just like any other tooth that you can use normally. And that's the goal, is saving teeth. So making sure that you come in before, that cavity gets to the point where it's in the nerve. At that point, the tooth needs to be evaluated, depending on how much of that tooth is left. We can decide on whether we can save it or not, and then go ahead and do that root canal and crown, and then get you back on your way.
Wow. Okay.
Yeah.
So that, with medicine, we really don't learn a whole lot about dentistry. So, and thankfully I have not had a lot of dental issues personally. So I've never had that done, and never had to look up that procedure until you just explained it. And so when they're going in and cleaning out the nerve, what happens to the nerve then? Like, it's, you said you go ahead and fill it. Like, are you still able to feel things in that tooth moving forward? Is that nerve still, healthy, or what happens in there?
So once the nerve is removed, no, you won't have.
Okay.
Yes. So then we go in and we actually remove the nerve,
Okay.
and then we fill the inside of the tooth with
Okay.
a filling material. Yeah. And it's an antibacterial filling material, and then we put a crown on top of that. And once that's done, you do lose sensation to hot and cold and things like that. And again, once that root canal is done, it doesn't necessarily mean that you can't ever get a cavity on that tooth again, because the tooth is still there and the tooth is still underneath the crown that was placed. So the cavity there could still be a cavity that starts around it, but you at that point wouldn't feel it because the nerve is gone.
Wow. All the more reason, sorry to interrupt, but all the more reason to continue to come in for your regular care, because
Exactly.
you can't feel it. You don't know, previously when there was a nerve down there, eventually you would feel it, right? Yeah, it can maybe be too far gone by then, because as you said, you're in the nerve at that point. But once that nerve is gone, all the more reason to come in regularly to make sure that there are no cavities, because you could still, like you said, have an infection and have no clue that that's going on in there.
Yeah, exactly. Typically, if you start having a pain on a tooth that's had a root canal, that means that the bone around the tooth is probably breaking down from an infection. So at that point, again, seeing what needs to be done. Every case is so different and unique. And every tooth is so different and unique. So, it's just a matter of evaluating what's going on with the specific tooth. But at that point, we do have to take an x-ray, see what's happening. And that's why x-rays are so important. Just getting to see what's going on under the bone, under that gum surface, and even between the teeth with if you don't have a crown.
Wow, that's such interesting information and really valuable because, like you said, all of this can be prevented by getting regular checkups, by practicing good oral hygiene. And so we've kind of, I think, beat prevention to death. So let's let's hope that is at least a take-home message today. All right, so let's talk about, we said, you recommend, I believe you said twice a year at the minimum to get that cleaning. And then of course, if you do have some problems with your teeth, that's going to really dictate how much, how often you go is what I'm trying to say after that. So if you've got a filling or something like that, then you might want to go, maybe if they need to check on it again, et cetera. Correct?
Right. So every 6 months is kind of your routine visit. That's you don't have any issues. You're healthy. You're taking care of your teeth at home. You might have a filling or two, and at that time we take care of it. But every 6 months is the minimum. If you have periodontal disease or you've been diagnosed with periodontal disease, which is again when that bone starts to kind of break down because of the plaque around it, and your teeth may be getting loose, that is when you come in every 3 months or every 4 months. So depending on how, what's going on, you may be on what we call a perio maintenance. So similar to a regular cleaning, but it's typically after we've gone to the depth of that space between the gum and the tooth and really removed all that bacteria. So that's more than just a regular cleaning. That's a deeper cleaning, also called a scaling. So you may hear your dentist say, hey, that regular polish and cleaning is not going to cut it. We need to go a little deeper. We need to get into those pockets. We need to clean things out. That's just another way to say we need to get all that bacteria out that's causing that bone loss. So once that deeper cleaning is done, you will come back, every 3 to 4 months, continuing to measure, that separation between the tooth and the gum, and make sure that that separation is, getting smaller. We don't want really large pockets where bacteria can sit around your tooth and continue to break down the bone. We want to make sure that those pockets are smaller. That way, if you're at home and you're taking some floss around your tooth, you can get to the depth of that pocket and really clean it out. If you're not able to do that at home, then you're going to be seeing us more frequently. That way we can go to the depth of that pocket, really get that bacteria out and get things looking healthy. But I've had lots of patients that started off with severe periodontal disease and are doing great. Smaller pockets, healthier pockets, no, really not much mobility. So it's not, and it's not the end of the world if you have something like that. It's more about managing it once it's been diagnosed.
Absolutely. So, and just to be clear, that gap you're talking about is a result of that bone loss, correct?
So,
Okay.
So that gap between, I'm going to bring this back out here. So if this is your tooth and this is your gum tissue, we measure the separation between the gum tissue and the tooth. So we want to make sure that this bone is not kind of dropping down here.
Okay.
And then that gum tissue that pocket that we're getting between the gum and the tooth is not increasing. So we want that space to be small enough for you to get to at home. So we have this scale with numbers that we use, 1 to 3. I typically say, and I usually say 1 to 3 is where you want to be. So if you're hearing your dentist and they're, checking the health of your gums, we measure in millimeters, which is really, really tiny, but we measure in millimeters. We want those pockets, the healthy pockets are between 1 to 3 millimeters. 4 is kind of borderline there, but we don't want too much space where you're not able to keep things clean at home. And that's where we start treating periodontal disease when that bone loss is occurring and we're seeing that buildup between the teeth and that rock-like substance that I was talking about between.
Okay. So again, the way that we're going to prevent all of that is by brushing regularly, by flossing and coming in for your regular cleanings. Okay, perfect. So we do have to take another short break, Dr. Qureshi, and then we'll be back to talk some more about teeth.
Great.
Okay. You're watching What's Up, Doc on Muslim Network TV, and we'll be back after a short few breaks.
Assalamu alaikum. My name is Adam. You remember me? I appeared in so many episodes that Sound Vision has put on the market. No matter what. Hey, what's happening? Hey, oh, sorry. Lockdown is what it is. Well, continuing here. In this lockdown, Sound Vision never stops thinking about you, the viewer. We'll have to get back into production again, online and inline. Everybody in their own space, even me. Although I'm stuck with Lanisa.
Salam! Salam! Salam!
I know, you were shocked too. Well, let me continue. This is what I was going to say. Salam! 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 Cut! Finally, I get my own screen time again. Thank God. And so we invested in new equipment to bring you even better production with new songs and new singers and animations. Well, here are a few clips. And Sound Vision has brought all this into your home, making Islamic values and teachings easy. And if you know me, Adam, a multi-talented actor, well, sometimes I'm an actor and the reporter and the... Oh, that's enough. Let's move on to the next section. Well, you can watch these new episodes on our new app at www.adamsworldapp.com. We have previews happening every day on Muslim Network TV. Sound Vision has been serving generations, moving and changing with the times. We are all faithfully connected. That is a huge blessing. Your donation helps keep these programs available now and into the future. We take this job of helping tomorrow's Muslims today seriously, and you should too. Today, we need your help. Children absorb and learn from everything they encounter. Make that wholesome, positive, grounded in our faith. Together, we can accomplish our goal of raising better Muslims, better neighbors, and better citizens. Please donate generously. It's an investment in our future. But to finish, let me tell you, there are new scripts of my new mission. And it is something that I enjoy talking about. My new mission is space. Houston, we do not have a problem. Salam, see you soon.
Today we are talking about all things dental health and dental care. And joining us is Dr. Fariha Querishi. Before the break, Dr. Qureshi, we were talking about essentially what happens when you get a root canal, what happens when you have periodontal disease, and that bone loss and that gap increasing as far as what you're measuring for good gum health. Now, you mentioned earlier teeth sensitivity, and I think that's something that a lot of people suffer from. And one of the reasons you'd mentioned was that wearing away of the enamel or that outer surface of the tooth. Let's talk a little bit about that as far as what are some other causes, and then how can people combat that, or how can people kind of reduce those symptoms?
So tooth sensitivity can be caused by a number of reasons. Like I mentioned earlier, we talked about kind of acid erosion. That's what it's called. You know, having acidic foods, sometimes even, sucking on lemons, things like that, that all kind of wears away at the enamel. And that enamel, that outer layer that we showed earlier, that actually protects your tooth. It protects the nerve endings, as well. So once that starts to kind of break down, you start to get more sensitivity. And another way that can happen is even clenching and grinding. So this has been what I've seen in practice right now, pretty common with COVID and everything going on. A lot of patients are clenching their teeth and grinding their teeth. A lot of stress causes that to happen, and that can wear away the tops of your teeth. And when that starts to wear away, again, that enamel, that protective layer starts to wear away, and we see sensitivity like that. Cavities can also cause sensitivity. Again, that cavity getting closer to the nerve, that can cause sensitivity to hot, cold. If there's an infection, you will start to feel some pain with that. And then also, believe it or not, aggressive brushing. So if you are doing amazing and you don't have cavities, you don't have gingivitis, you don't have any gum disease, and you're being very aggressive with your toothbrush, you can't start to kind of wear away your enamel. And that's where we see sensitivity as well. That outer layer, that enamel layer, is what protects your tooth surface. Sometimes if you're brushing aggressively and you're brushing along the gum line, you can cause what we call a receding gum line. And the gum line can move up and expose the bottom half of your tooth, which is called the root, and that doesn't actually have any enamel on it. So that becomes more sensitive. So, clenching, grinding, acidic foods, again, aggressive brushing, wearing away at the enamel. And there's also something called parafunctional habits. Again, it just means you're kind of chewing on things or biting on things that are not food. So pen caps, nails, anything that you can't actually eat or you shouldn't be eating is kind of hard on your teeth and can actually also wear away the enamel. And then fractures as well. Fractures in the teeth, which can be caused by bruxing or clenching, and then biting on these objects, that can also cause fractures as well. So different things cause sensitivity, and there are some things you can do to kind of treat that sensitivity that you're feeling. One thing I typically tell my patients is to use toothpaste like Sensodyne. It does have a desensitizing agent in it that actually block off little nerve endings that come to the outside of your tooth. So it blocks those channels off and helps prevent that movement of fluid through those channels that would typically cause sensitivity, and it helps relieve that discomfort.
Awesome. That was a super thorough explanation of different things that can cause it, because I didn't even realize something is harmful. I don't necessarily do that, but I see a lot of people chewing, like you said, especially our younger population, on like pens or pencils, and a pencil. I don't think people use pencils anymore, but hands of hard things. And that can, and to think that is something that seems so harmless is actually causing, or could potentially cause, a lot of harm is really interesting to hear. When you mentioned brushing aggressively, that reminded me of when I go to the store. There are different kinds or types of toothbrushes, and there's it'll say hard or soft or medium. And so, if aggressive brushing is detrimental to tooth health, should there even be a hard option? Should we always be picking soft? Because I never understood why there were even options, Yeah,
that's actually a great question. I always recommend soft bristle toothbrushes.
Okay.
Honestly, there's a lot out there. First thing you want to do when you're buying something is check that there is an ADA seal on it. And what that means is that product has been approved by the American Dental Association. Okay. That's pretty much the first step. And then when you're picking what toothbrush you want, I would go towards that soft bristle toothbrush. We have a tendency of trying to get things done quickly. We're going to want to get through brushing as fast as we can, and we want to be thorough. We want to get all that plaque off. And that aggressive brushing does lead to enamel wear and gum recession. So those two things combined can lead to sensitivity. So yes, I would recommend a soft bristle toothbrush. And something really neat that the electric toothbrush companies have come out with recently is pressure sensing indicators.
Oh, cool.
So when you use this toothbrush and you are applying too much force, it will actually beep or vibrate, let you know that you need to pull off a little bit. Okay. So what you really want is the bristles of your toothbrush to touch the tooth, but that's about it. You don't need to put too much pressure. So as long as the bristles are touching your tooth, you want to do, soft circular motions with your toothbrush and go along the gum line with your toothbrush, at a 45-degree angle, or just, angle along the gum line and go around, but don't push too hard, because it's pretty common to want to get everything nice and clean, but you don't need to put that much pressure. So it's great that, those electric toothbrushes have come out and have identified this as an issue, and have come out with the pressure indicating, mm-hmm. And then the soft bristle toothbrushes are my go-to. Those are my favorite.
Okay. Yeah, I like them too. That's what I use. So you mentioned electronic devices or electronic toothbrushes. There's also the water pick versus regular traditional floss. So when it comes to what we're using at home, what is your stance? I know I've heard different things from different dentists. I feel like it's a personal preference. I don't know that there's any conclusive evidence out there saying that one is superior to the other if there's good technique on both sides. But when it, like, what's your stance as far as using electronic devices, or should we be doing it old school?
So technique.
Okay.
Okay, so if I've seen people use electric toothbrushes that, still may not be getting what they need to get, and maybe a manual toothbrush would be better for them, just because, again, with the electric toothbrush, even if maybe you don't have the one that has the pressure indicating and you're pushing too hard or you're not getting into that right spot, if you are not going around like I mentioned, outside, tops, and inside, it doesn't really matter what you're using, right? So we want to use, something that kind of fits the shape of your mouth. Some people have wisdom teeth, or if you have braces, pick a toothbrush that's right for you. It's not one size fits all. People have different preferences. Some vibrate more than others, some rotate. If you're asking me what my preference would be, I would do an electric toothbrush, and I have seen a lot of improvement in oral hygiene with electric toothbrushes. It adds another layer of getting into those spots. It might rotate where you're not able to get to. So I do recommend electric toothbrushes, but if you're not able to get one, you can do just fine with a manual toothbrush. Just making sure you're getting into those areas, getting the size you need, I think, is key. There are manual toothbrushes that are circular and smaller. So getting behind certain teeth, or, under your braces, that's important. So really just technique. And then flossing, I know that's always a big question. Water pick, can I use the water pick instead of floss? Personally, I've seen it. Flossing cannot be substituted. So that string floss, getting it in there, curving around each tooth, and that's the technique you want to use. You want to go down and go along each tooth, making that C shape with your floss to get any plaque that's sitting under the gum off. So water picks are great for patients with periodontal disease, with implants, with braces, just to get around certain areas that are hard to get with just floss. But I would definitely use it as a supplement.
Okay, that's good to know. That's really good to know. And something that I was taught growing up was to always brush my tongue.
Yeah.
And I noticed, and I realized that, I look in people's mouths as part of their evaluation. I always look in their mouths, and I noticed that people don't, that I guess not every mother taught their kid to brush their tongue. What is your stance on brushing your tongue, and what's the proper way to do it? Can you use your toothbrush? Should you be using a special tongue scraper? Let's talk about that.
So cleaning your tongue is so important. Just like your teeth can hold bacteria, your tongue is one of the main parts of your mouth that can harbor a lot of bacteria. So if you're seeing white on your tongue, just like that white along your teeth is plaque, that same bacteria, that is building on your tongue can cause bad breath. It affects the way you taste things. So if you enjoy food, I would encourage you to, spend some time.
Things might taste a lot different if you start brushing your teeth.
It's really interesting. But, if you're dealing with bad breath, that's one of the places I would try to see if you're missing that in your routine. Definitely adding in, ideally, a tongue scraper. So you can get them anywhere. They look kind of like a horseshoe. You would stick your tongue out and scrape off any plaque or any buildup that's just sitting on your teeth. And then, the back of your toothbrush, some toothbrushes do have some ridges on them to help take off anything that's sitting on your tongue. So at least doing that. But ideally, I think getting a tongue scraper and, going over your tongue a few times just to clean off anything that's there, is a good option to prevent even bad breath and enjoy your
and enjoying food in a way you never thought you could.
exactly.
Okay, and unfortunately, we're running out of time, Dr. Qureshi, but I do want to squeeze in a couple more things that I think is really important to share with our audience. And one is, how young should we be thinking about taking in our kids to get their teeth checked? I think we spoke earlier, and I tell my patients, and I remember this particular case, it was a 2-year-old, and I was like, looking in her mouth, and I was like, hey, have you been to the dentist yet? And she looked at me like I was the crazy one. She was like, what? She's too young. And I was like, oh, she's got teeth. So I don't think so.
And, it's so important to start young. So the recommended time to come in to see your dentist is either the first tooth or when they're a year old. So, and the reason for this is, we'll check everything, of course, to make sure things are looking healthy. And then we kind of talk to parents about, what to expect when you'll see more teeth erupting, how we should be brushing, how we should be flossing, and talk about different techniques as far as brushing and flossing, because I know some kids can give you a really hard time with that. So, talking to your dentist about how to manage that. There are different positions you can use to help make things interesting, or different things to do to help brush and floss. But that's one thing. And the other thing is more so to get the child acquainted with the dentist. So going to the dentist at a young age without having any real issues, and just seeing, hey, they're going to check my teeth, they're going to brush this area, and I get a cool prize, and build
Not
that
candy.
rapport, build that
Prize is
relationship.
not candy, right?
Yeah.
The prize is
Yeah.
not candy. That's my
Presents.
favorite. It's when you go to the dentist and you leave with candy. I'm like, talk about job security.
Yeah. As long as it's sugar free, but typically you'll get a prize. And that really encourages, I have patients that come and they can't wait to see me. They bring their favorite book, and they have their drawing of their visit to the dentist that they
sweet.
and that just means that they are not expecting to come just to get something filled. So if you wait, if you wait till they're 3 and we've never done a checkup, chances are that they might have a cavity. So now their first visit is, hey, this person is gonna, drill something. And typically that fear of even coming into the dentist is already there, because parents have that fear, and they'll like, oh, you don't want to eat that? Do you want to go to the dentist? Or
It becomes like a threat.
there.
Yeah, I'm gonna take you to the dentist if you don't listen to me.
Exactly. So that's not how you want to promise any punishments. We don't want to be a source of fear for children. We want it to be more of a relationship. Hey, we come, we get our teeth checked. We just need to see them every 6 months, because guess what? If we're checking your teeth every 6 months, we're kind of reinforcing these habits, and we're cleaning anything that needs to be cleaned. We're placing fluoride that helps strengthen that outer layer that prevents cavities. And then there are also other treatments. When the cavities are small, there's something called SDF that a dentist can actually place over a cavity if it's small enough, and actually stop that cavity from getting bigger and avoid fillings altogether. So, so there's importance to coming is, building that relationship, having children see their dentist as not something to fear, but something more routine, and then not necessarily having to deal with just coming in for fillings and little baby root canals, which we see quite often, and extractions. We want to avoid those things. So the less that they have done, builds that relationship. And, at that point, if they need something done, we are there, and they have that trust. They've had that relationship with us where they know we don't just do that all the time. And the same thing goes for adults, but especially at a young age, we don't want to instill that fear. We want to build that good relationship at a young age, and kind of have that rapport with the parents, with the children, and move forward with kind of letting them know this is what oral hygiene is, and that will change really the trajectory of how they take care of their mouth for the rest of their lives.
Oh, those are some great points, Dr. Qureshi. So essentially getting them in early will help, like you said, develop good habits and a good relationship with the dentist. So it's not always when I go there, I have to have something done. You know, just like you said, an adult, if you go regularly, you don't always have to have things done. You just do your regular checkup and your preventative exam. I know we are pretty much out of time, but very briefly, Dr. Qureshi, I want to send this message out because I also see OB patients, and they are always fearful, and they tend to want to delay their dental hygiene or dental, coming in for dental care until after they have had the baby, because they just feel like it's unsafe to come in to get things done when they are pregnant. But in fact, as I mentioned in the introduction, it is one of causes for possible preterm labor. And so just if we can just briefly touch on the safety of dental care during pregnancy.
Sure. So it's actually encouraged for women that are pregnant to see their dentist. So during pregnancy, you have different things going on with your hormones. You're more likely to have pregnancy-induced gingivitis. So that's just terminology for swelling and bleeding of the gums that increases. And then, once that's there, that bacteria is able to kind of increase in that environment. And all of that can cause, preterm labor. And there are some studies that say preeclampsia, things like that. So it's important to come in, get your cleaning, and it's actually encouraged sometimes, maybe twice if you need it, just to get that bacteria out of your mouth and keep things healthy. And then also, if you need dental treatment, it's, there are certain times during your pregnancy where it's okay to get that done. So obviously we would talk to Dr. Al-Barwani, right? And then we'd say, hey, so this patient needs this, and this. We're thinking about, doing a filling, or maybe even, a root canal, things like that. We need to take some x-rays. We communicate with the doctor, and for the most part, that all is fine as long as, that you don't have any other medical conditions, and it's in certain periods of your pregnancy. So we do avoid any unnecessary treatment. So, if you're planning on getting whitening, we don't really know how that affects pregnancy. So we'd say hold off on it. We would hold off on anything elective and just go for treating things that are needed.
Mm-hmm.
And more importantly, getting those cleanings in so it doesn't affect your pregnancy and in turn cause preterm labor.
Okay, awesome, Dr. Qureshi. Thank you for endorsing that.
Yes.
There is just so much more that we could talk about, but we are definitely out of time rather at this point, unfortunately. So we might have more material for a second episode, so stay tuned.
Yeah.
But thank you so much for your time. We really enjoyed the information that you shared with our audience today. A lot of valuable tips, a lot of new things that even I hadn't known about, because I've been blessed to not have dental issues. But thank you again, and we appreciate your time, and we wish you every success in your career.
Thank you. Thanks so much for having me.
Absolutely. Thank you for joining us on another episode of What's Up, Doc. We hope you enjoyed this episode. You can watch this along with our other episodes on our YouTube page at youtube.com/Muslim Network TV, and on our website, muslimnetwork.tv. I'm your host, Dr. Aalia Al-Barwani, and I'll join you next time. I hope you'll join us next time on another episode of What's Up, Doc.